What is pelvic inflammatory disease? Hello everyone. Once again bring you greetings from us to all great women in the world. This is What Women Want channel, where we talk anything and everything about women's health. Pelvic inflammatory disease is an inflammation of the female reproductive organs. It can cause to scar formations with fibrous bands that form between tissues and organs. It can affect the uterus or womb, the ovaries, the fallopian tubes, or a combination. Complications include chronic pelvic pain, persistent ectopic pregnancy, and infertility. From study of the Centers for Disease Control and Prevention, CDC, 1 in 8 women trusted, who have had pelvic inflammatory disease have difficulty becoming pregnant. Most cases cause from an untreated infection in the vagina or cervix that spreads. Fast facts about pelvic inflammatory disease. Pelvic inflammatory disease often stems from a gynecological infection or other untreated sexually transmitted infection. Symptoms may not be obvious, but they can include pain and fever. Untreated PID can cause scarring, fertility problems, or an abscess. Usually, treatment is with antibiotics, but surgery may be necessary. Precaution strategies include doing safe sex and not having multiple sexual partners. Symptoms of pelvic inflammatory disease. Many women with PID have no symptoms. If symptoms appear, they can vary from mild to serious. However, untreated PID can have serious consequences. Risk factors. Some risk factors increase the risk of developing PID, apart from an STI. Childbirth, miscarriage, or abortion. If bacteria enter the vagina, the infection can spread more easily if the cervix is not fully closed. An intrauterine device, IUD, a form of birth control that is placed into the uterus. This can increase the risk of infection, which may become PID. Endometrial biopsy, in which a sample of tissue is taken for analysis, increases the risk of infection and subsequent PID. Appendicitis increases the risk very little if the infection spreads from the appendix to the pelvis. Prevention for pelvic inflammatory disease. PID can be a serious condition, but there are ways to minimize the risk. Do screening regularly, especially for those who have many sex partners. Ensure sexual partners are tested for infections and STIs. Not pushing, as this increases the risk. Using condoms or cervical caps and practicing safe sex. Don't have sex too soon after delivery or termination or loss of pregnancy. Sex should not be continued until the cervix closes properly. Thank you for watching. Please like, comment, share and subscribe. See you in the next video.